I was watching TV with my parents, and then this sensualized condom ad came on, and I was like, oh my God, where do I look? And then I was like, wait. I'm old enough to know about condoms, watch condom ads, and even talk about condoms. And that's exactly what I'm going to do today. Of course, you know the show, Allo, Ask the Sexpert, a space where we invite sexual health and wellness experts to talk about sex, pleasure, wellness, and so much more so that you can have better sex backed by science. Today we have another expert from Allo Health, Dr. Karthik, who's a psychiatrist. How are you doing today?
I'm doing well, Artika. Thank you.
So, Dr. Karthik, right, we were talking about condoms. I think condoms are the first thing that one thinks of when we think of sex, whether you know a little bit about sex or a lot. So, are you ready to get into this conversation?
Definitely.
So, I think when it comes to condoms, one thing that we want to talk about is safe sex. But on the internet nowadays, there's a word called safer sex, which is trending. And I'm just sitting and wondering, what is the difference between safe and safer sex?
Frankly speaking, safer sex is possibly a misnomer. Okay. There is no difference between safe, safer, or safest sex.
Yeah.
Okay. This is probably invented by people who are, a bit more anxious regarding sexual activity.
Right.
Who actually want to feel a bit more safer. So they have invented this. So probably, if you ask me, safer or the safest sex is always with protection and possibly with a condom always.
Right. I mean, that's exactly why we wanted to talk about condoms today. So what is the reason that condoms have become so popular? And it's not just today. They've always been very, very popular for so many years. They're part of government policies. They're part of, public health centers as well. So what is the reason that condoms are that popular and not some of the other methods?
Yes. So when we talk about anything which is helping us in having a safe sex or safer, to be really frank, there are a few things which we have to keep in mind. One is the side effect of anything which we use, or one is the availability. Now, condoms have revolutionized the sex industry because of the availability, first thing. And the other one is because of being devoid of any of the side effects, which probably the other methods of contraception have.
Yeah.
So condoms as such right now are the cheapest and the safest method which can be used as a contraceptive, which also actually as an added benefit prevents any kind of transmission of STD, sexually transmitted diseases, when you're actually involving yourself in any kind of activity.
Yeah, you're absolutely right. When you say condoms are not just for unplanned pregnancies, but also prevent STI transmission or lower the risk. Even then, I know of so many people who don't want to use a condom. So what's your take on that?
Yes. So as I was telling, condom is actually the safest and the cheapest method available right now. But there are certain religious constraints in few communities which divide them from using a condom. And moreover, a few people do not use it because it actually affects their pleasure. However, there are new types of condoms right now which are used to enhance pleasure, all these things. But condoms usually come with a small amount of anesthetic gel in them. That is, in fact, to increase the timing of the male partner. But as a side effect, they actually cause, reduced sexual pleasure. So that is why some people, avoid using a condom.
I think that's a very scientific fact that you mentioned, though. I don't think a lot of people even know that fact. I actually know a lot of people who've never used a condom and they're like, we'll never use it. So I think, if anything, this information should help them make a decision.
So now, if a person does not want to use a condom, there are various other methods which he can use. However, you should know that preventing a STD, condom is the best way. So we would actually stress upon using a condom as much as possible, especially if the person has multiple sexual partners or if it's something else. However, if he doesn't want to use, then there are different methods, like we say the calendar method, where you know, all of us know that the lady ovulates usually on the 14th day of her period. So sex should be avoided between the 10th day and 20th day, if you consider the starting day of the period. Okay, like if your period starts from 1st of this month, from 10th to 20th, you should avoid sex. Maybe before that or after that, it's safe, but not 100% effective. You should know.
And that's why we use the word safer.
Yeah.
That it's safer and it's not 100%.
Now it depends on the context whether you're looking at avoiding a pregnancy or you're looking at avoiding a sexually transmitted disease.
Absolutely.
Okay, so apart from calendar method, then there are OCPs, oral contraceptive pills. Then again, the side effect profile of these drugs are too much.
Yeah.
They cause some period abnormalities, mood swings in the female partner especially. Okay, sometimes bloating, sometimes weight gain, all these things. So other safer method, if you are with a single partner, if you're married looking for a long-term contraceptive method which is safer, is actually intrauterine contraceptive device. Now there are various contraceptive devices, again rates starting from 1,000 to 10, 20, 30,000. But you need to consult a gynecologist for that, who is going to appropriately advise you which IUD is preferable. But again, it's reversible, so it should not be a problem.
I mean, like very personally speaking, as someone who ovulates, I don't even think of the calendar method as a method of contraception. Like we said, it's kind of comes with a lot of risks. And to the point that you made, that you should consult a doctor. Currently in India, OCPs are also prescribed medicines. You can't buy them over the counter.
Yes.
So I definitely feel like there's some weightage to you saying that any of the method that one decides to choose should come through a doctor's recommendation for sure. And just talking about, all of the various methods that you named right now, which work to prevent unplanned pregnancies, but do not work to prevent STI transmission. Is that correct?
Yes, definitely. Condom is the only way where you can actually avoid a pregnancy and an STD.
Right. So it brings me to a question that I have to ask you, because I've seen it floating around all over the internet, which is, can you have safe sex without a condom? And what does that question even mean?
Okay, so to be really frank, I've had patients who call me up, who consult me and ask, I don't want to use a condom. I want to have sex. I want to prevent STD. Is there any pill to do that?
Yeah.
You just give me a pill before sex, which I pop in and I am completely safe.
Is there a pill?
No.
Oh.
Okay. If there was a pill, condoms wouldn't have been so famous. Not really.
Yeah.
Okay. So nothing of that sort. However, if there is a post-exposure, invariably you got into a sexual act and right now you're scared.
Yeah.
Okay. So that way there is something called as post-exposure prophylaxis, where we give a pill for a period of 1 month. Depends on the pill, frankly speaking. But again, none of it is 100% sure.
Right.
These, you have to keep it in mind, these were invented for doctors, to help doctors, because if they're operating or if they're in contact with a HIV patient and there is some transmission, then to prevent the HIV from coming into our body, it was invented. It was never invented for the purpose of having unprotected sexual activity with a partner and then pop in a pill. Doesn't work that way. So the safest method, not even safer, the safest method is always a condom.
Right, got it. I think that was a really cool capsule about condoms and just explaining why condoms are so popular. And I do have to tell you that we do have a segment where we get audience questions. So can I take you into that segment?
Sure.
And for everybody who's tuned in, this section is called Ask Your Question, where you can drop your questions in anonymously. There is a link in the description, and maybe we'll pick your question and ask them to the Sexpert the next episode. So let's get into it, Dr. Karthik. The first question I've got is, can I get infections through oral sex, and is there a way to prevent it?
Yes, frankly speaking, if a mucous membrane touches another mucous membrane, there's always a risk of infection.
I think just to explain for the audience, mucous membrane.
Something apart from the skin.
Right.
Okay.
Yeah.
Touches, then there is always a risk of transmission. Definitely. Slightly lesser when compared to normal vaginal sexual intercourse.
Okay.
So the risk is more when we talk about anal sex. The risk is slightly lesser when we actually talk about oral sex as such.
And with oral sex, do you think condoms, again, since we were talking about condoms, can be a way to prevent or at least reduce the risk?
Definitely. That is why there are so many flavored condoms right now.
Right. I think people don't know that also. A very good point you brought up. But yeah, moving on to the next question. The next question is, I used a condom when I had sex last, but now my period is late. Could I be pregnant?
Yes. You have to realize that even condoms are only 98-99% safe.
Right.
There is always a chance of rupture of the condom, or sometimes what people do is they wear a condom after having sexual intercourse for some time, just before ejaculation, just to avoid the pleasure. So the pre-ejaculate which comes, that can also lead to a pregnancy. That might also have some amount of sperms in the body. So even that can lead to a pregnancy. Yes, there could be a chance. You need to get it checked.
You need to get it checked. Great, absolutely. The third and the last question for the day is, if I'm having sex with more than one person, how often should I get tested?
You need to realize that even if you get tested just after sexual activity, the reports usually come negative. You at least have to wait for
period.
You at least have to wait for 20 days, where the body picks up the infection, starts throwing antibodies. That is what we detect in the test.
Right.
So yes, how often? Now that depends on you. There is an entity called venerophobia where people test themselves, once every month or once every week for ages together. Probably not recommended.
Yeah.
Wait for 20 days after your previous exposure. Get yourself tested. If you're negative, just stay calm. You're negative until unless you show any symptoms, or if you show any symptoms like there is any lesion in the penis or in the personal part of a female, or if you're having recurrent fevers, then it's better to get tested. Okay. There is no recommended criteria for this. Usually, it is 20 days after your previous sexual activity.
Got it. I think that was all of the questions we had, and you answered them also brilliantly. Thank you so much. That does bring us to the end of this episode. And before we go, I have to tell you all that you please keep your comments coming in. You can write to us. You can also DM us. This is me, Artika, and Dr. Karthik signing off. We'll see you again with another expert in another episode. Until then, take care and bye.